Hi there, this is David Newman, CEO of Brain Scanology and principal inventor of CDT Open, our digital clock draw test app. In this presentation, I'm going to talk about the ability of CDT Open to provide stable readings between the first and second time it is used. This is known as test-retest reliability and is important in the field of behavioral health. The clock draw test is a classic tool used by psychologists and psychiatrists to determine if you have cognitive impairment. People are asked to draw a circular clock with 12 numbers and two hands pointing to 10 minutes past 11. And a sign that someone has dementia is that their concept of a normal clock is actually very different than what it's supposed to be. And these patients are unable to recognize how odd their clocks look. Brain Scanology has created a phone app called CDT Open. It is free and it is available on iPhones and Androids. It's pretty easy to use. You just have to draw a clock according to our rules on a piece of paper, photograph it according to our rules, and upload it to the app. And the app will then send you a report showing what we measured in the form of 7 numbers, and each number has a scale. We've also determined what the ranges are for normal clocks and abnormal clocks for each of these 7 numbers. So the drawer can objectively assess the shape of their clock from the comfort of their living room. It's important to point out that the drawer must follow our rules for drawing. First, let's look at the shape of the clock. Drawers should draw slowly and carefully and avoid ovals, and they should avoid putting tick marks on the edge of the clock, which is a common practice in drawing clocks. Not following these rules will result in erroneous scores. The current version of CDT Open, which is version 1.3, only measures the shape of the clock edge, also known as the clock face. It does so in the form of 7 numbers, and here are the scales of what is normal and abnormal for index E1. There are 3 zones to be aware of. First is the normal zone, second is an undeterminable zone, and third is the abnormal zone. Each score will fall within one of these 3 categories. As to what these 7 indices measure, indices 1 to 3 measure the shape of the clock edge in terms of how circular it is, how smooth it is, and how symmetrical it is. Index E5 measures whether the clock is a closed object, that is, there are no openings along its line, such as in the case of a dotted line. And then indices 6 and 7 measure whether the left and right hemispheres are similar to an ideal semicircle. It's important to note that the linearized compressed polar coordinates transform, which I invented and which is the key algorithm in our clock draw test, measures subdimensions of spatial information, that is, of shapes, that the human eye cannot see. Thus, the terms maybe and unknown in this table. In our ongoing study of cognitively normal patients drawing clocks, we see that there is a high test-retest reliability of CDT Open. Again, as you can see in this legend, the white zone means normal, the middle zone means undeterminable, and the pink zone means abnormal. If you look at index 1, here are the data for 27 drawers between the first time they drew a clock compared to the second time they drew a clock. And as you can see, all the dots here are in the normal white zone. There is 100% agreement between the 2 tests in terms of whether or not the values are in the normal zone, and an F1 score of 1.0. 5 of the 7 indices, that is E1, 4, 5, 6, and 7, have 100% agreement and an F1 score of 1.0. The other 2 have high percent agreements and strong F1 scores. This shows that for users who are cognitively normal, when a user draws a clock for the second time, the results given by CDT Open are not drastically different compared to the first time they drew the clock. And it should be noted that the average time between the first and second drawings for this group of people is 35 days. It's important to point out that CDT Open is not meant to be a one-time diagnostic test. CDT Open is best used over time, meaning once a month or once a quarter, depending on your level of risk for dementia. It was designed to show if your clock shapes are consistently moving in or staying in the abnormal zone, which is a warning for you to seek professional help. This app is a computerized cognitive assessment aid. I'd like to discuss why we did not choose a linear method when calculating test-retest reliability. The first reason is because I designed CDT Open to measure the natural variation in how a person draws clocks. And thus I define the normal range for these indices to have a wide range of values. And this negates the usefulness of the Pearson correlation, which assumes that linear trends are the ideal way of representing stable relationships. Now, if I had designed the normal ranges to be from 1 to 5 or from 1 to 100, then yes, the Pearson correlation would be effective. But in this case, it is not. Secondly, the purpose of CDT Open is to track changes in these numbers over time for the purpose of determining whether the numbers stay in the normal zone, undeterminable zone, or in the abnormal zone. Thus, since there are 3 categorical or nominal variables, normal, undeterminable, abnormal, the appropriate test-retest statistic is a kappa statistic, such as Cohen's kappa or the F1 score. In this case, I chose the F1 score because there's high class imbalance resulting from the fact that all of our users are cognitively normal. Let's take a look at how abnormal clocks are measured by CDT Open. Here are examples of abnormal clocks. All of these clocks are synthetic clocks, meaning our team drew them to mimic examples that we found in literature of clocks that were drawn by people who had dementia. Thus, these clocks are not from real dementia patients, but they mimic the patterns we observe that are persistent in clocks drawn by people with dementia. As you can see, there is a robust difference in each of the 7 indices between normal drawers, in this case are the actual drawers in our study in blue, compared to our synthetic abnormal clocks, as you can see in orange. The high statistical significance between the differences we see in these graphs is why CDT Open is a very unique and novel way of analyzing the clock draw test. Lastly, here are the benefits of CDT Open compared to other digital clock draw tests that are out there. I would like to briefly highlight that the top advantages have to do with health equity benefits. That is, CDT Open is free and accessible to low resource areas that only have pen, paper, and low-cost smartphones. We created the basic version to be free for this very reason. In the area of clinical benefits, CDT Open does personalized tracking of the changes in each person's drawing style or drawing habits, instead of making a classification of yes or no or normal versus abnormal. And CDT Open can precisely measure very subtle changes in hand tremor or drawing habits that a human therapist would not know how to objectively assess. CDT Open is unique because we do not measure pen stroke velocity, and our machine learning models do not make binary classifications of yes or no or normal versus abnormal. We measure changes in the shape of the clock, which was the original intent of the classic clock draw test. CDT Open is unique because we have the linearized compressed polar coordinates transform, which I invented, and allows us to measure subdimensions of shapes that the human eye could not see and that were impossible to measure until now.